Hi, um, my name is Alyssa, I guess, and I work as a nurse on a dementia and medical surgical unit in Calgary. Um, I've been following some of the medical groups on Facebook where medical professionals from all around the world, mainly doctors and nurses, share their frontline experiences with patients diagnosed positive with the virus. Discussed are mainly problems that they've encountered during this time, in which, if we haven't encountered, we will foreseeably encounter. There has been much concern and dispute regarding PPE, which is personal protective equipment. One being that we are running out of stock at a very, very quick rate, and two, as a result of running out, we have limited choices as to what the next steps are. One, if we run out of PPE, we either care for the patient using equipment that personal protective equipment that we've already used before, so equipment that isn't cleaned or sanitized, or we don't use PPE at all, which is the same as using used equipment. We ultimately catch the virus, and whether we present with symptoms or are asymptomatic, spread virus to other patients, our colleagues, and bring it home to our family. Number two, our second option is that we don't care for the patient because we can't protect ourselves, which could result in the patient's condition deteriorating or patient becoming critically ill, which could lead to the patient just dying. So it comes down to the fact that we honestly don't really have much of a choice. Anyways, there's this one post that someone posted on one of the groups, and it brought me back in. It brought me to absolute tears. I reposted it on my Facebook because it's very true and powerful and important for everyone working in healthcare to hear. I ultimately chose to pursue nursing because my dad was sick with kidney failure, and I saw at a very young age the direct impact healthcare professionals have on the family of the patient, and so that's what I wanted to do. I wanted to be able to provide as much comfort and care for the patient and the family as I'm able to, because I know that when my dad was sick, nothing else mattered. I was entirely affected by it. I couldn't focus on anything after he passed away because I was so upset. And so I want to be able to be there for people who are experiencing these very difficult times. This is what I had reposted. It basically said, "To all my fellow healthcare workers, you have been asking me what to do if we run out of PPE. With news of 13 Italian doctors dying from COVID-19, here is the answer. There is no emergency in a pandemic." And this one sentence just brought me to tears. If you do not have proper PPE, do not go in, no matter what. And although I've read it more times than I can count, it's still pretty emotional for me. It's hard, it's extremely difficult to accept because it's something that, as a healthcare professional, you never expect or imagine to have to be in that situation where you have to choose either to help the patient or not help the patient because you don't have proper protective equipment. It's very hard to accept because instinctively you would rush in to that patient's room to help them. Whether they're in critical condition or they had a fall or you need to code them because they had a heart attack, you instinctively rush in. I had a patient that was on contact precautions for an infection, and the patient had fallen And I was just so concerned that, and I was honestly more worried about the patient's safety than catching anything. So I ran over, I grabbed some gloves, and I ran inside the room. To do it properly, the proper way of applying PPE is you would sanitize your hands and then put on the gown, sanitize your hands again, put on the gloves, and then go inside. But I had just grabbed a pair of gloves and ran inside because I was so worried. The patient was okay, and I was monitoring them in the doorway while I was applying the gown and the gloves. So, it comes down to it being an ethical decision. Um, Ethically, you instinctively also would run in to help the patient because that's why you chose nursing, because you want to help people and because there should be no reason why. There should be no reason that anything should be in between you and helping that person. And for us to be running out of personal protective equipment for ourselves if this patient has COVID-19, is positive with it, or has any other illness. This is an incredibly hard decision that all of us will have to make. And let me tell you, it's not an easy decision. It seems easier said than done. Protect yourself so that you can protect others. But it is much easier said than done, as I said earlier. This is real, and this is the situation. While I was reading this and reposting it, I was listening to Spotify. This one song came on, and it's called God, I Look to You by Bethel. I just wanted to sing a little bit of it and share with you the overwhelming wave of peace that this song gave me when I heard it and while I was in complete tears. And I hope that I'm able to give you even just a little bit of that peace that it gave me during this hard time. Be prepared. Put on earphones sorry, not earphones. Put on earplugs if you need, because my voice is very okay. But yeah, here it goes. These are the lyrics. God, I look to you. I won't be overwhelmed. Give me vision to see things like you do. God, I look to you. You're where my help comes from. Give me wisdom. You know just what to do. So it goes. God, I look to you. I won't be overwhelmed. Give me vision to see things like you do. God, I look to you. You're where my help comes from. Give me wisdom. You know just what to do. And then the next part goes, I will love you, Lord, my strength. I will love you, Lord, my shield. And I will love you, Lord, my rock. Forever, all my days, I will love you, God. I love how it says, I won't be overwhelmed. And before it says, I won't be overwhelmed, it says, God, I look to you. Give me vision to see things like you do. Because we are human and we are so short-sighted, and although the only thing we can see right now are all the problems that we are having to face, whether we're working as frontline staff, the problem of the multitude of deaths, the problem of the sickness and the rate of contagion, the problem of layoffs, and the direct effect on the economy and small business owners. In spite of all these problems, we should not be overwhelmed, and we should focus on God and ask for vision so that we can see things the way that He does. God, give me wisdom. You know just what to do. And then, I love you, Lord. You are my strength. You are my shield. You are my rock forever, for all my days, through, the good times, and the times where thousands of people are dying. And you have to choose between which patients to save and which patients we can't save. Just to trust God and to love Him and to know that He has plans for us and that He promises His plans are much better than the times that we are going through right now. So even during this overwhelming time, I think it's important that we stay as calm as best we can, to focus and look to God, and to know that He is in absolute control of everything, and that we ultimately shouldn't worry about what will happen because God's plan is perfect, and because everything will happen accordingly to His plan. So as hard as it is to stay calm during this time, especially with the potential for loved ones to become fatally ill, focusing on God is what will get us through it. And this is what I have been doing to keep myself calm and to bring a certain level of peace that I can't obtain anywhere else. Honestly, we don't know how long this will last, and we anticipate how many cases we will have and the duration of the virus. However, we know that we are at the beginning of the curve and that we haven't even hit the peak. So it'll be at least a couple of rough months, but ultimately we will get through it together. So, it was a long talk, but thanks for sticking with me through this video, and thank you so much for keeping the community safe and lessening the amount of patients that are admitted to the hospital by staying at home, by simply staying at home and avoiding as much human contact as possible, as hard as it may be. I appreciate it. I want to say that all the healthcare professionals appreciate it on an extreme appreciation level. So thank you. I hope, I don't know, I hope I influenced you with this video, or that I brought you some peace. If you have any questions, you can post them in the comments, or you can message me. I would be very happy to answer them. And yeah, we are doing the best we can, and focusing on what God has in store for us in the future. And yeah, we'll get through this together. So thank you.